Are you struggling with a wound that leaks through your dressings, soaks your clothes, or even your bedding? You're not alone. Heavy wound drainage is one of the most common challenges patients face. In this video, I'm going to explain what wound drainage is, why it happens, and the best ways to manage it safely at home. Hi, I'm Nurse Alyssa, a wound care nurse dedicated to helping people and caregivers understand how to care for chronic wounds so that healing is safer and feels less overwhelming. If you're new here, make sure to subscribe because every week I share simple, nurse-approved wound care tips to help you or your loved ones heal. What is wound exudate? So first, what exactly is wound drainage or what we call exudate? So exudate is a fluid that naturally comes from a wound during healing. Some drainage is normal and it keeps the wound moist, carries away waste, and helps the healing process. But here's the catch. Too much drainage can actually be harmful. When there's excess fluid, it can break down the skin around the wound, delay healing, and increase the risk of infection. That's why managing it is so important. Why do some wounds produce heavy drainage? Now, you might be wondering, why does my wound produce so much fluid? There are a few common reasons. Venous leg ulcers, which happen when the blood pools in the lower legs, these often leak a lot of fluid. Infections can increase drainage. Larger wounds or burns usually do have more fluid, and certain conditions like diabetes or poor circulation can make it worse. The key thing to remember is a sudden increase in drainage or fluid that looks or smells unusual is a red flag. So you always want to check this with your healthcare provider as it is a sign of infection. Daily care tips for heavy exudating wounds. All right, let's talk about what you can do at home to manage heavy exudate. Step one, you want to protect the skin around the wound. Excess moisture can cause the skin to turn white, soft, and break down. To prevent this, you're going to apply a barrier cream or skin protection film around the outside of the wound, not the inside. Step two, you're going to choose the correct dressing. This is critical. Different dressings handle different levels of drainage. So a foam dressing, it works well for moderate fluid. Alginate dressings are excellent for heavy drainage because they can absorb a lot. Super-absorbent pads are for very high exudating wounds that leak through quickly. And for some patients, doctors may prescribe negative pressure wound therapy, which is a machine that gently suctions fluid out of the wound. Step three, change the dressing as often as needed. If the dressing is leaking or soaked, it's time to change it out. Leaving it too wet puts you at risk. Step four, manage swelling. So if your provider has cleared you, compression therapy can help reduce swelling and decrease fluid production, especially in venous leg ulcers. Step five, you want to make sure that you are supporting healing from the inside out. So your body needs the right nutrition to heal. That means protein-rich foods, vitamin C, zinc, and plenty of water, and avoid smoking, as this dramatically slows down the healing process. If you're interested, I do have my wound healing cookbook available on Amazon. I will link it down below. It has a ton of recipes for breakfast, lunch, and dinner, so you know that you are supporting your body, giving it the nutrition it needs to heal. Warning signs and when to seek medical help. Now, before we wrap up, here are warning signs you should never ignore. If your wound suddenly starts draining a lot more than usual, if the drainage turns green, tan, thick, bloody, or foul smelling, if you notice spreading of redness, swelling, or you develop fever or chills, or if your dressings are soaking through every couple of hours despite proper care, all of these can be signs of infection or other complications, and you need to contact your wound care nurse or doctor immediately. So, to recap, heavy exudate is common but needs to be managed carefully. Protect the skin using the right dressings, manage swelling, and fuel your body for healing. If you want more of a step-by-step guide, I have created a digital wound care guide for patients with chronic wounds. Or if you want a more personalized care, you can book a one-on-one Zoom session with me to create a plan that's tailored specifically to your needs. You can find the links below this video. And don't forget to subscribe for more wound care tips. I'd also love to hear from you in the comments. What's your biggest challenge when it comes to wound care? I may just cover it in a future video. Thanks so much for watching and happy healing. Don't forget to visit my website, thewoundconsultant.com, for all your wound care needs. Whether you're seeking professional wound care consultations, access to high-quality supplements, holistic healing, digital resources, informative books, or high-quality wound care supplies, we have everything to support you. Whether you're dealing with a wound or you're a healthcare professional, there's something for everyone. Visit today and take the next step in effective wound care.